everybody. I am Victoria Vega, and I'm here to present to you my vulnerable student population part 2 for this week, and I decided to focus on restraint and seclusion. So before we jump in, I want to just define what restraint and seclusion is. So I used our course materials this week, and I learned and kind of refreshed my memory because I have a lot of experience with restraint and seclusion. So, just as a brief introduction to it or explanation, we learned within the course materials that restraint is limiting or restricting students' movement. There's 3 different types of restraint, which are mechanical, which is using objects or different things to restrain a child's behavior, which would be zip ties or handcuffs. Chemical, which is giving medication in order to immobilize, and physical, which is hands-on ways to restrict a child's movement. Of course, physical restraints are the only type permitted in a school setting. Seclusion is an involuntary confinement. It's the removal of a student from the rest of the group when their behavior and reaction is in danger to themselves or others. So here I have what are the potential benefits and or drawbacks to, restraint and seclusion. For restraint, I said it can be beneficial if the student is in danger of hurting themselves or others and needs a way to calm down safely. Seclusion can be beneficial when the student is at risk of harming themselves or others due to their bodily reactions or behaviors in that given situation. However, there is a lot of drawbacks to restraint and seclusion. If it's not done correctly, it can bring serious harm to not only the student but the adult. It can have negative behavioral side effects after the situation is handled with restraint or seclusion. It can increase that negative behavior, and then it can also set negative examples to the peers around them who are witnessing this seclusion and or restraint. So some policies regarding restraint specifically that we learned within our course materials was in the Arizona Revised Status 15-105 Part B, Sections 4 and 5. A student's ability to breathe must not be obstructed, and the restraint technique may not be out of proportion to the pupil's age or physical condition. So this can, of course, support families and students if, unfortunately, the restraint is not done correctly and is out of proportion with the student's age or physical conditions. This protects the family and or student if it's not done safely, that legal action can then be taken or just change within the restraint and how it's done on the student. Hopefully this never gets to a point that this has to happen, but unfortunately, there are cases and times when a staff member or somebody handling a child is not doing this right. So going into my personal experience, I had mentioned that I do have experience with restraint and seclusion. I personally have had extensive training. I do want to highlight that it seems very excessive to do restraint and seclusion, and even myself does not like to resort to it. However, those who do, have the option to apply it, if that makes sense, are extensively trained on it. So much so that we're encouraged not to do it if we don't have to. So I have done it in the past. However, it's very far and few between. I will do anything in my power, try all my resources before. However, there is just some cases where children are at extreme harm to themselves or others, and it is the last resort in what we have to do. I do rather, again, prefer to go more in different routes of social emotional methods before I will come to that option. So I just really want to highlight that this isn't something that is the first option that I personally resort to. I don't think it's very appropriate to do so. However, I do believe that there is some settings that it is your only option to keep not only the child themselves safe, you safe, and the peers around them safe. So how does my effect and my viewpoint change after knowing what I knew about the ACEs and its influence that it has on students and families? It affects my viewpoint just because I know what coming from a ACE heavy background and trauma response can have on a student. And that very much shows in these type of behaviors at school. It does open my eyes and it gives me a lot of empathy when dealing with students who are very reactive, and their reactive shows in bodily reactions. It does give me more empathy when having these crises with students and their behaviors do become very physical, that a lot of the time it is a response to negative behaviors that are going on at home or trauma responses, and just keeping that in mind can not only help me as an educator stay calm in those moments, but just have a lot of empathy in how to move forward with these kind of behaviors. So thank you for watching my presentation, and I look forward to hearing your thoughts and your opinions and watching your own presentations. So thank you.